Lens replacement surgery is a very safe procedure. It's very safe. It's important to realize that it's one of the safest procedures that you can have done. For example, there are 400,000 cataract procedures performed in the NHS every year. The main risk is the risk of loss of vision. Again, that's exceedingly low, and that can range from 1 in 500 to 1 in 10,000. The other risks are the capsule which holds the lens may become damaged during the procedure, and that may cause difficulties in implanting the lens at the time of surgery, but there are various ways around that. The UK average for that sort of complication is about 2%, but most consultant surgeons have a lower rate of complications from that type of complication, rather than 2%. For example, myself, it's about 0.4. Other things that can happen are you're not meeting the refractive target that you wish to achieve. But the fantastic thing about if you do choose to have your treatment here with us, we offer a service where we're able to tweak that with the other refractive procedures that we can offer. So it's an all-inclusive thing, which you may not get elsewhere.